What exactly is mastitis, and who are we typically seeing it in?
Right. So mastitis is an inflammation of the breast tissue. Quite often there's an infection involved too.
Inflammation and infection.
Yeah, and it presents with, swelling, redness, pain, and warmth in the breast. It most commonly affects people who are breastfeeding.
Right, the classic presentation.
But, and this is important, it can occur in anyone. So it's something to keep in mind beyond just the breastfeeding population.
That's a very good point. How fast do these symptoms tend to show up? And what specific signs should providers be looking out for?
They can come on quite suddenly, really quick onset. And it often affects just one breast, though sometimes both.
Okay, sudden onset, one breast. What else?
Key things to look for. Definitely breast tenderness, swelling is usually obvious, and patients report pain or a burning feeling.
Burning, got it.
Yes. And look for skin redness. It often has this characteristic wedge shape.
Ah, the wedge shape. That's a helpful visual.
It really is. Also, warmth to the touch, maybe thickened tissue, or even a distinct lump. Patients often feel generally unwell, kind of flu-like symptoms.
Flu-like, so fever too.
Yes, absolutely. A fever of 38.3 degrees Celsius or higher is a common sign.
Got it. So if inflammation is the issue, what's actually causing it? What's the root cause?
Well, the main trigger, most often, is milk getting trapped in the breast. Milk stasis.
Milk stasis, trapped milk.
Exactly. When the milk isn't removed effectively or regularly, it just sits there. And that can lead pretty quickly to a blocked milk duct.
Okay, so the blockage is key.
It is. And then bacteria can get involved. They often enter through maybe small cracks or fissures in the nipple or even through the milk duct openings themselves.
What kind of bacteria are we usually talking about?
Often common skin bacteria like Staphylococcus aureus. It takes advantage of that environment.
Makes sense. So beyond those direct causes, what makes someone more likely to get mastitis? What are the risk factors?
There are several. Having had mastitis before definitely increases risk.
History matters.
It does. Also, sore or cracked nipples, they provide an entry point for bacteria. And pressure on the breast.
Pressure, like from clothing.
Yeah, exactly. Tight bras, seatbelts, even how someone sleeps. Improper breastfeeding technique is a big one, too.
How so?
If the latch isn't good or the baby isn't draining the breast effectively, that leads back to milk stasis.
Wow.
Or it can cause nipple trauma.
Right, the trauma again.
Mm-hmm. And don't forget systemic factors. Things like being really tired, stressed out, poor nutrition, and smoking can all play a role. They can kind of lower the body's local defenses.
Okay, so a patient comes in, you suspect mastitis. Yeah. How is it formally diagnosed? And what's the immediate treatment approach?
Diagnosis is mainly clinical. It relies on that physical examination and the symptoms the patient describes. Pretty straightforward, usually.
And imaging.
Sometimes. In non-breastfeeding individuals, or if the presentation is a bit unusual, an ultrasound might be used, mostly to rule out other things, like an abscess already.
Got it. And treatment.
Treatment focuses on two main things. Antibiotics, if an infection is suspected or confirmed.
Standard antibiotics.
Yes. One's appropriate for the likely bacteria and safe for breastfeeding. And crucially, ensuring the breast is emptied regularly. Very important.
How's that done?
Either by continuing to breastfeed frequently or by expressing milk pumping or hand expressing.
Now, that's a point that often causes confusion. Should someone continue breastfeeding if they have mastitis? Especially if they're on antibiotics.
Yes, absolutely, yes. Continuing to breastfeed is strongly recommended.
Why is that so important?
Because it's actually therapeutic. It helps clear the blocked ducts, it resolves the stasis, and it gets the milk flowing. Stopping abruptly can make things worse.
And it's safe for the baby, even with the infection or antibiotics.
Yes, it's safe. The infection is typically in the breast tissue, not significantly in the milk itself, and the commonly prescribed antibiotics are safe for infants.
Okay, that's really critical advice for providers to give. What about self-care at home? What can patients do alongside the medical treatment?
Good question. Recommend rest. That's really important. Plenty of fluids. Warm compresses before feeding can help with milk flow.
Before feeding, warm.
And then cold compresses after feeding can help with pain and swelling. And over-the-counter pain relief is fine too, paracetamol or ibuprofen.
Good practical tips. And thinking longer term, how can we advise patients to prevent this from happening again, or in the first place?
Prevention really circles back to effective milk removal and taking care of the nipples.
So, practical strategies.
Feed on demand. Don't let breasts get overly full. Make sure the baby or the pump fully drains the breast during feeds or sessions.
Fully drain. Anything else?
Yeah, try changing breastfeeding positions regularly. That helps drain different parts of the breast. Ensure a proper latch from the start to avoid nipple damage.
And the clothing thing again.
Right, avoid tight bras or clothing that puts constant pressure on the breasts.
Okay. Now, what if mastitis isn't treated properly or promptly? What are the potential complications?
The main complication we worry about is a breast abscess.
An abscess. What does that look like?
It's basically a collection of pus within the breast tissue. It usually presents as a very painful, swollen, often well-defined lump. It might feel fluctuant, like there's fluid inside.
And that requires more intervention.
Yes, an abscess typically needs to be drained, often surgically or sometimes with needle aspiration, along with antibiotics. It's definitely something to avoid if possible.
So when should a patient know it's time to seek medical help or maybe come back if things aren't improving?
Well, they should seek care initially for any concerning breast symptoms, of course. But specifically, if their symptoms don't start getting better within, say, 12 to 24 hours of trying home care, like frequent emptying and pain relief.
You need to be seen.
Yes. Or if they've started antibiotics and they're not seeing improvement within about 48 hours, they need to be reevaluated promptly.
That time frame is important.
It really is. This underlines why that early treatment is so vital.
Why specifically? What are the key benefits of jumping on it early?
Well, first, you prevent those complications like an abscess forming, which is a much bigger deal to treat. And second, prompt and effective treatment helps maintain breastfeeding.
Preserving the breastfeeding relationship.
Exactly. Which has so many benefits for both the parent and the baby. Early intervention makes that much more likely.